Morbid obesity. Morbid obesity is the term applied to people who are more than 2 times their ideal body weight or whose body mass index exceeds 30 kg per meter square. Another definition of morbid obesity is body weight that is more than 100 pounds greater than the ideal body weight. Patients with morbid obesity are at higher risk for health complications such as cardiovascular disease, arthritis, asthma, bronchitis, and diabetes. They frequently suffer from low self esteem, impaired body image, and depression. Medical management. Conservative management consists of placing the person on a weight loss diet in conjunction with behavioral modification and exercise. However, diet therapy is usually unsuccessful. There is a belief that depression may be a contributing factor to weight gain, and treatment of the depression with bupropion hydrochloride may be helpful. Bupropion bupropion hydrochloride. Some physicians recommend acupuncture and hypnosis before recommending surgery. Pharmacologic management. Several medications have recently been approved for obesity. They include sibutramine hydrochloride and orlistat. 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 By inhibiting the reuptake of serotonin and norepinephrine, sibutramine decreases appetite. Orlistat reduces calorie intake by binding to gastric and pancreatic lipase to prevent digestion of fats. Both medications require a physician's prescription. Sibutramine may increase blood pressure and should not be taken by people who have a history of coronary artery disease, angina pectoris, dysarrhythmias, or kidney disease, and by those taking antidepressants or monoamine oxidase inhibitors, or by pregnant or nursing women. Side effects may include dry mouth, insomnia, headache, increased sweating, and increased heart rate. Side effects of orlistat may include increased bowel movements, gas with oily discharge, decreased food absorption, decreased bile flow, and decreased absorption of some vitamins. A multivitamin is usually recommended for patients taking orlistat. Women who are pregnant or nursing should not take orlistat. Surgical management. Bariatric surgery or surgery for morbid obesity is performed only after other non-surgical attempts at weight control have failed. The first surgical procedure to treat morbid obesity was the jejunal bypass. This procedure, which resulted in significant complications, has been largely replaced by gastric restriction procedures. Gastric bypass and vertical banded gastroplasty are the current operations of choice. These procedures may be performed laparoscopically or by an open surgical technique. In gastric bypass surgery, the proximal segment of the stomach is transected to form a small pouch with a small gastroenterostomy stoma. The ROX-NY gastric bypass is the recommended procedure for long-term weight loss. ROX-NY gastric bypass. ROUX, ROX-ENNY gastric bypass. ROX-NY gastric bypass. In this procedure, a horizontal row of staples creates the stomach pouch with a 1 cm stoma that is anastomosed with portion of distal jejunum, creating a gastroenterostomy. The transected proximal portion of jejunum is anastomosed to the distal jejunum. In vertical banded gastroplasty, a double row of staples is applied vertically along the lesser curvature of the stomach, beginning at the angle of HIS. A small stoma is created at the end of the staples by adding a circle of staples or a band of polypropylene mesh or silicone tubing. After weight loss, the patient may need surgical intervention for body contouring. This may include lipoplasty to remove the fat deposit or a panniculectomy to remove excess abdominal skin folds. PANNICULECTOMY, panniculectomy. Lipoplasty, LIPOPLASTY, lipoplasty.